Dr. Waswa William is bringing digital detection to cervical cancer care. He's developed quick scanning digital microscopes, which he makes with a 3D printer. His software then quickly scans and analyzes patient samples.
Our innovation can provide timely, accurate diagnosis, but can also help look at cells that are actually coming or becoming cancerous. Because the computer has been trained, it knows how a cancer cell looks like, so it can actually predict.
Dr. Waswa says his system is 97% accurate. The innovation has also been peer-reviewed in several academic journals. This fabricated 3D microscope is able to detect and digitize cervical cancer cells in just under 10 minutes compared to the manual diagnosis that requires up to 2 weeks analysis. The manual method requires cancer experts to analyze samples through a microscope. Dr. Waswa says that is more time-consuming and may be prone to human errors. His system is still going through scientific trials and is currently being tested in a local hospital. Digital microscopes are not readily available in low-income countries because they are expensive. But Dr. Waswa hopes to change that.
In a very busy setting, they can actually tell you to come back in 1 or 2 weeks to pick your results. And because of this, some patients actually don't go back to pick results. Because research has shown that there is a lot of loss to patient follow-up. That's why some patients go, but they tell them come for your results, they actually don't go to pick the results.
In Uganda, 40% of all cancer cases are cervical cancer patients. The Uganda Cancer Institute says uptake for cervical cancer screening is still low and many patients arrive when it's too late. The Cancer Institute says in order to prevent deaths, innovations like Dr. Waswa's are welcome. But it warns better access to care is needed to prevent deaths.
The number of people who at least know something about cancer has gone up to about 7% in the country. So that means actually awareness has also doubled, which is a good thing. But now, creating awareness and people being aware without them having access to care will be meaningless. So that means we need to do more.
Dr. Waswa is also working on training his machine to analyze other forms of cancer. He's working with hospitals around the country to adopt his technology to improve access to quick and timely diagnosis at affordable costs.
So guys, that's Dr. Wasawa William in Uganda. He designed this digital detection system for cervical cancer. And it also connected to a 3D printer, can print exactly to show you where it is, how it looks, the size and all that. But I'm telling you, how much of you have ever heard of this new technology that can detect cancerous cells? Almost immediately, and in like a couple of minutes, and it's done. But what? The pharmaceutical companies will be pushing back on this. For why? Because cancer research, cancer pills, radiation, and other things is a multi-billion-dollar company. They make billions of dollars annually. These companies or these people, they don't care about people's health as to save anyone. They have to maximize profit. So you can imagine the deep cut this is gonna cost in these companies' pocket. So they won't allow this. So don't be surprised if you hear that he's have some form of accident somewhere. But anyway, let's get to that after. This is 97%. This is 97% accurate. 97% accurate, and it's still in the stages of they're using it in certain hospitals, but it's not. He haven't gotten pattern or get to use it globally yet. But cervical cancer is a big deal globally, right? Especially in countries like low income, well, not countries, let's say in low income areas. It's dangerous for those people who cannot afford to go to the doctor, get the test, and then the result and all that. As I said, it takes 2 weeks. But if someone can come to the doctor, do the test, in a minute, get back the result, and it's less costly than the original way. It will save more lives, and it will help more people to live longer and keep families together, and it won't make families go broke trying to treat cancer. Because this early detection means prevention and also mean cure. But this won't fly in the States or in Europe. I'm telling you, this will not work in the States because these companies gonna push back on this because it's gonna make too much of a drastic dent in their profit margin, and that's all they care about is profit, not people. And I really hope he will get this pattern, and if not, I hope all African countries, all 54 of them, put this in their hospitals, and hopefully can get to work with the BRICS and get this in Brazil, Russia, China, and those places. And then he can, maximize his exposure so they have less chance of trying to attack him or try to steal this invention. I hope he keep it very protected because it's gonna be a big deal once it's come to fruition. Like it's already to fruition, so that's not the right word. When it start to use globally, and it can save lives, cut costs. Again, from my knowledge, and this is what the AIDS Foundation do as well. Not to get sidetracked, but notice it, the AIDS Foundation making billions and billions of dollars annually because they're not trying to save people's lives or try to design a better product to make people live longer. Not to make people live longer and healthier lives. They design things to make us constantly taking them until the day you die. So it's not to help you, it's just draw as much money out of you as possible and keep you alive as long as they can with inferior meds to drain you of all the funds. So that's how the pharmaceutical companies work. They don't invent anything to cure you. It's only to help you along the way, to drain your pocket. That's it. This now is a very great and brilliant invention, and it's always African inventors always come with these things, doctors, engineers, and then after a while they don't hear about it because it's the machine kill all these from getting exposure. And I want to keep an eye on this. Let's keep an eye on this and see how it is. Let me know what you think about this in the comment section of this brilliant digital cervical cancer detection system that is 97% accurate. 97% accurate. And it's not, you're not hearing this non-known major news network. No, it's neither the BBCs, the CNNs. None of them, you're not hearing nothing about it. I just accidentally book up on this. But it's a big deal. It's a big deal for the continent. So anyway, as I know, thanks for watching. You know it's a WSXM. Tell a friend. Like, share, and subscribe. Peace. One love. Boom.